So we're going to do our newborn assessment. So we want to go in and identify ourselves, provide for privacy, wash our hands, glove up. We've got the warmer ready. We went ahead and placed the temperature probe in the warmer to make sure that the warmer doesn't get too hot for the baby. So we're going to go ahead and put our gloves on. And while we're just waiting for the baby to be born at this point. So the baby was born. So we'll get the baby from the mama. We'll place them head down to facilitate drainage. We're going to want to dry her off, rubbing her feet and her back especially to facilitate crying. We want to go ahead and suction her nose, her mouth. We want to put a hat on her to make sure that she doesn't have any heat loss, a diaper on her to prevent soilage. We want to go ahead and take the towel out from under her because it's wet, and wet or towels or blankets because that can make it cold. Then we want to go ahead and assess the cord. It has 3 vessels, so we're good there. Then we want to go ahead and do her APGAR. So what we're looking for is, does she have good flexion? Is she crying? Does she have acrocynosis in her feet and hands? She does not. She's pink. Whenever we move her, she responds to stimulus. She cries. She's not just laying there limp. We will listen to her heart rate and her respiratory effort in just a second. She came out active. Her legs were flexed. Everything was good. She didn't just stay in one position. She moved around as we stimulated her. So that's good. So then we would go ahead and listen to her heart rate and her respiratory effort. Her heart rate is, we would count beats per minute, so it's at 120, so it's over 100, that's good. We would then want to go ahead and we would want to get, do her eye prophylaxis, so we get a washcloth, and we would clean from the inside out using a clean part each time. And then we would take the erythromycin ointment and put it in the lower conjunctival sac. That's good. We would then verify our orders and make sure that we have an order for a vitamin K shot. So we would take the shot, it's a 5/8 25 gauge needle, and we would put in the thigh, just like that. We would then want to make sure we identify our baby before it left the room. So we need to match our identification bracelets to the mom's. And we put one on the wrist. And we put one on the ankle. So we done the vitamin K shot, we done the erythromycin ointment, we done her full APGAR assessment, we gave her a hat, put her diaper on, we dried her off real well. We will go ahead and take her now. Since we assessed the cord, we can go ahead and take her and wrap her up. So we just wrap her like that. Okay, so that our baby is ready to do kangaroo care. We want to go back to our APGAR and make sure that we got everything. We did check her activity, we checked her pulse, we checked to make sure she was responding to stimulation, we checked her skin color, and we checked her respirations. She was very active. She had over 100 beats per minute. She had 120. She was pink all the way around, even her hands and feet. She responded to stimulation when we rubbed her feet and her hands, or her feet and her back, sorry. And she had a vigorous cry. She didn't just lay there limp. So we will take the baby to mama now for kangaroo care, and that is our newborn assessment. We would also document.